The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad you're with us today, and we're glad you're with us, Dr. Nedley. And we're going to be talking about some very interesting things that hopefully will not be depressive, but will be impressive and will lead us to not be excessive. How's that for a beginning? Well, we're going to talk about lifestyle and depression. I guess the first thing I want to ask is, what really is depression? You know that saying, ask two doctors, get three answers.
Well, you won't as far as depression is concerned because it's very well classified. If you have 5 out of 9 symptoms, those 5 or 9 symptoms would be deep sadness, apathy, agitation, lack of concentration, change in appetite, or a change in sleep habits, feelings of worthlessness, morbid thoughts, or fatigue. If you have 5 out of those 9, you would fit the definition of depression if they have lasted for over 2 weeks and not preceded by an emotional traumatic event.
So if someone has died in your family, of course you're going to be depressed in a sense, but that's more of a...
That's what we call situational depression, and that resolves with time. Major depression tends not to resolve with time. It actually tends to brew and stew and even worsen with time to the point where complications of the depression start setting in.
You know, some of the lists that you've just clicked off are very important for those viewing and whatnot, and you've written a new book on this subject that either is out or will be out very soon, and if people contact Three Angels, they can get in touch with you and you can let them know about that book, I'm sure. But now, looking at that definition, we can know for sure whether or not someone really has depression. You're suggesting in this chapter of your book that we've been discussing that lifestyle behaviors really have an impact on whether or not we're going to have depression, or if we do have it, whether or not we can reverse it.
That's right. In fact, lifestyle seems to be even more important than nutrition is. We have emphasized the importance of nutrition and depression and treating it and preventing it, and it is important. But more people are depressed because of lifestyle issues than are even depressed because of a poor diet.
One thing that we haven't mentioned, and of course I think that nutrition is in fact the medication we choose to take, in a sense, God's medication for us, and we talked about that a little bit previously, but what about medication?
Medication for depression can be very helpful in mild to moderate to even severe cases of depression. The problem with medication are its side effects, and I actually, as a practicing physician, do prescribe many antidepressants. I always try to choose the best one with the least side effect profile for the patient that's sitting in front of me. But I also try to find the root cause of the depression so that we can treat that cause and get them off of the medication. About 90% of my patients are able to get off of their medication within a 6-month period of time once we put them on the appropriate nutrition and lifestyle treatment program.
Is that right? 90%?
90%. And if you take a look at the statistics from the psychiatric community, they will tell you 80 to 90% of patients will not be able to get off of their medication. Their depression will actually relapse and reoccur once they get off their medicine. And that's simply because we have covered the symptoms with the depression, but we haven't cured the disease. And my interest is finding the cause and curing the disease so that the person is no longer dependent upon medication and no longer experiencing the side effects. Prozac, for instance, is a wonderful medicine as far as enhancing mood. It decreases crying spells, it increases social affiliations, but it also increases impulsiveness. In addition to that, it will increase teeth problems. Actually, teeth gnashing tends to occur more frequently under the influence of Prozac. And then, in addition, it can cause even sexual dysfunction and other types of side effects, as well as about a 10 to 15 pound weight gain in individuals who take it. And so this is not a medicine that really should be used long term in the vast majority of cases if we could find the root cause and treat the actual cause of depression.
So nobody watching today should just go ahead and stop all their medications and say, I heard it on 3ABN.
No.
They should get with a qualified clinician, maybe get a copy of your book, get in touch with you and get some of the research that's in there and show it to their physician, and then maybe get in touch with somebody who's aware of some of these things. They can address the underlying causes, but not stay on medication necessarily the rest of their life. They're not doomed to that, if you want to say doomed, or they're not really just put in that narrow box.
Right. In fact, once you're on a good nutrition and lifestyle treatment program, I still keep my patients on their antidepressants for usually about 4 to 6 months. And then at that point, we're able to discontinue it in a rather abrupt fashion, and they can live a normal life and actually feel much better without their medication than they did with.
Unless they go off the nutritional lifestyle.
Correct.
And so we want to talk about those lifestyle issues today. What are some of those lifestyle factors that are connected with whether or not we're depressed?
Aerobic exercise is one that we have to talk about. Aerobic exercise not only can prevent depression, but it can actually treat it. In fact, a recent study, Don, showed that aerobic exercise was equivalent to a standard antidepressant medication after they were on the exercise program for 4 months. Now, it doesn't work as well for the short term. In fact, that's why a lot of people, once they try exercise, they'll say, well, it didn't work for me. But it doesn't work after a session or two. We start noticing an effect a week after the exercise program begins, and this is a daily physical exercise program.
How long a day?
30 minutes a day. And then at 4 months, we have the peak effect. And at that 4-month point, they will have just as much benefit as if they had taken Prozac or one of the standard antidepressant medications.
So action is a law of life, and it's certainly one that can reverse depression.
That's right. It not only helps the heart and helps prevent cancer, but actually physical exercise helps prevent as well as treat depression. And this is the aerobic type of exercise, which would be like brisk walking or swimming or jogging or bicycling. Or digging in the garden if you're digging vigorously enough for 30 minutes a day. That type of exercise is very helpful.
Now, you know, I haven't heard you, and we've talked about this, and I've looked through your book, but I haven't heard you talk a lot about counseling. Let's say you had a decision to make. You can either talk to somebody about your problems and try and peel away the skins of the onion to get to the middle of the core of the problem, or you can go walking. If you had to choose between those two, which would you choose and why?
I would actually choose walking. Although counseling, if done by the right counselor and done with the right type of what we call psychotherapy, the right type of counseling, can also have beneficial effects. But counseling opens up a whole other discussion that is worth talking about, and maybe now is a good time to do that. But the traditional type of counseling that is done for depression actually is no better than taking a placebo pill. As far as what it does for depression.
Let's come back to that. But you were saying really that maybe the best thing is to walk, and if you can talk while you're walking, that's fine.
That's right. There you go.
Okay. So walk, and is walking one of the best aerobic exercises? Swimming, bicycling, what?
Yes, walking is a very good one. It has to be brisk walk, so you're breathing more rapidly, your heart rate goes up, and not just a leisurely stroll down the street, but a nice brisk walk.
I don't know if I struggle. I don't have the 5 of the 9 symptoms that you say depression is or major depression. I haven't struggled with that. But I can certainly tell you that when I walk or when I exercise in the morning, I feel a lot better all the way through the day, mentally, spiritually, physically.
Well, you know, and this is true of a lot of these lifestyle factors for depression, and even the nutritional factors that we mentioned before. We've talked about it in the setting of depression, but even non-depressed, normal individuals will feel better when they do this program and when they eat the right foods. And so if a person is not depressed, that doesn't mean this program is not for them. actually they'll end up feeling better if they get on this program.
So this is a anti-depression program for those that are not even depressed.
That's right. It can even enhance the mood in those that are have quotes normal moods.
Now I notice you have in your book something about deep breathing and depression. Explain that.
Deep breathing actually is a mood enhancer as well. And you have to breathe deep enough so that your oxygen saturation stays up around 99%. And in order to do that, studies show it's best to breathe as little as 6 times a minute. Now, the average person will breathe about 12 or 16 times a minute, shallow breaths, and when they're sitting like we are here today, Don, or in a classroom, or if they're sitting in front of their television set, their oxygen saturation actually will start to go down. And once it goes down less than 94%, it detracts from the frontal lobe, and it can actually chronically bring about or help bring about depression.
Okay, so you know, we should just take some deep breaths right now, I think.
That's right.
Oh man, it feels good. So deep breathing, but you're saying that deep breathing is not necessarily fast, shallow breaths, real deep breaths that get the
slow
oxygen
breaths
way down to the bottom of your lungs.
Yeah, get the watch out in front of you. You want to take a breath about every 10 seconds, in and out, very slowly. And actually, those that take exercises, there are exercise sessions we give for deep breathing. If they exercise just in their deep breathing, sitting in their chair or standing, they will have an elevation of their mood throughout the entire day, particularly if they try to institute that deep breathing method through the rest of the day. Who would have thought the
treatment for depression or preventing depression, hey, just breathe.
That's right.
Really breathe.
Yep,
breathe
deep
right.
breathing.
Okay, you have another one down here, classical music therapy. Now, all these, I assume, in your book, you've documented them scientifically, you have all the studies for that.
Right.
But what about classical music therapy?
Well, classical music therapy is really the only type of therapy that has been shown to both subjectively as well as objectively enhance mood.
What do you mean by that?
Well, you know, some people will listen to their favorite types of music and say, you know, I feel better when I'm listening to this music, and they think it makes them feel better the rest of the day as well. But when we study it objectively, like taking a look at their blood levels of cortisol, for instance, the cortisol levels don't drop. They actually might go up, and it might actually worsen their depression, even though they think it's covering the symptoms for the time being.
So like heavy metal music or these things that cause high stress, like they're getting hit by rockets or something, that really increases the possibility of depression.
Correct.
Okay, so classical music does it both subjectively, they think it's helping them, and objectively, that's the facts.
That's right. It helps them on both. And this type of music is Bach, Respighi, Handel, Brahms. This type of music has been studied where you're listening to it intently for 45 minutes every 2 weeks. And it will enhance the mood significantly, it will drop the cortisol level significantly, and it will help people that didn't even think they liked classical music. In fact, in the age group it was used, it was not the favorite type of music at all.
What age group was it?
It was a 23 to 45-year-old age group. An age group that in this country has not really seriously been exposed to classical music except for a jingle on a commercial here or there. But they were actually to seriously be in front of their stereo set contemplating this music, and it did wonders as far as their mind was concerned.
So that's what you meant by just really focusing on it. You can't just have it on in the background.
It's not just background music.
It needs to be the primary source coming in both ears.
Coming in both ears, and where you're not really doing anything else except thinking about your own life and then also listening to the music.
Wow, well, you know, that saying, it's time to face the music, really has meaning here, doesn't it?
Yes, it does.
And it can cause us to be less depressed. We have discovered that, as we've talked with you and the research in your new book, that depression actually can be reversed or avoided if we're exercising, if we're breathing deeply, and if we are, what was the other thing that we talked about?
Classical music therapy.
Classical, how could I forget it? We were just talking about the different classical music we would like. I need to work a little bit on my memory, but the classical music would be good. What are some other things that we can do in terms of avoiding or reversing depression, lifestyle-wise?
Well, lifestyle-wise, getting enough sleep. Actually being on a regular program where you are getting 7 to 8 hours of sleep per night, and you get that at pretty much the same time every night. as well as being on a regular program throughout the day, regular breakfast time, regular lunch time, regular supper time, if you choose to eat the evening meal. These factors can go a long way in avoiding as well as treating depression.
Didn't you say that compulsive disorders are also related to depression?
Well, obsessive compulsive disorders can be.
So with this routine and schedule, you know, what about if you're the person that has that all scheduled up and someone messes it up?
Well, I mean, you've got to allow some flexibility from time to time. This isn't something that you have to do like a religious nature per se every a single minute of the day and have it timed out. But many people on weekends get themselves off of schedule. They're going to bed at all sorts of different times, from 9 o'clock at night to 2 o'clock in the morning. And they're really not on any type of regular schedule. And these are people that are markedly set up for the risk of depression.
What is the, okay, you have children, right? How old are your children?
8, 7, and 3.
Let's say, let me ask a couple questions. With children, can they become depressed?
Yes, there can be depression even in children and adolescents.
And then the second question is, what is a good pattern for children of those ages to, when should they go to bed, when should they get up? What's a very good pattern for them?
Actually, earlier to bed and earlier to rise tends to make a child healthy and eventually wealthy, but certainly wise for the time being as far as how wise a child can be. But no, the reason why earlier to bed helps out is because you increase your melatonin levels. Melatonin is increased in the bloodstream only under periods of complete darkness. And if you are going to bed late at night, the morning sun comes in too early and you haven't actually experienced your melatonin peak yet. And so we recommend going to bed is around 9 o'clock or so, or for a child possibly even earlier than that, and then getting up early when the sun gets up is a very good program to be on.
Okay, so now it needs to be dark. You know, my parents used to put me to bed when it was still seemed like 2 o'clock in the afternoon. Doesn't it have to be dark though?
Well, there isn't anything wrong with going to bed an hour before sundown. It takes a while for the melatonin to start after you go to bed anyways. It takes several hours to get the peak there.
I can tell your kids don't put anything past on you. All right, so regular restful sleep. And the same thing when they hold true for the schedule for adults too. They need to go to bed early.
That's right. It even works better for adults.
Okay, you have down here bright light therapy. I think I got that last evening driving here from St. Louis. I think I had some bright light therapy with these people flashing their bright lights. But is that what you mean by this?
No, that probably wasn't enough.
What do you mean?
Outdoor light is really the best type of bright light to experience. Takes 2,500 lux, and that means that it's outdoors for at least a half hour during daylight hours. And that would be a half hour after sunrise or a half hour before sunset during that time period. Okay. And actually, morning bright light therapy is better than evening bright light therapy. And so if you are able to do your morning exercise while the sun is still up, you have got 2 major lifestyle factors dealt with at the same time. And
you could deep breathe while you're at that and have classical music on right there on your headphones.
There you go. There you
go. Focus on that. Now, daylight savings time doesn't throw that off, though, right?
Well, no. I mean, it's still a half hour after sunrise or a half hour before sundown.
Right. Okay. Bright light therapy and the best out in the sun. Okay. Avoid negative thinking. How do you do that?
Well, this was a very interesting study at Ohio State University that was run on well over 200 people. And they took a look at optimism, they took a look at pessimism, they took a look at stress, they took a look at a number of mental factors. And the one factor that emerged as being the most important as far as depressed mood was concerned was pessimism. Actually, optimism came out as being neutral in this study. In other words, it didn't have any positive effect or any negative effect. You know, you can have a problem with too much optimism.
You think so? Some people have accused me of that. So, does it depress you if you're too optimistic?
Well, when realism continues to hit you in the face, it can set you up for depression.
Okay, I see what you mean. Right.
And so you really want to think more realistically, but especially to avoid the pessimism. You know, a lot of people continue to look at the most potential negative consequence, and fearful of that and always thinking about that, they end up being quite pessimistic individuals. And you can a lot of times notice these people when they go out in nature. You know, we were at a nature hike the other day where it was a cloudy day, and the individuals, it was near raining, but all you could hear about were the problems with the clouds and the rainy days and how they didn't like that. When there were beautiful trees to see, there was beautiful grass, a beautiful lake there. And in this world, there's always going to be negative things and positive things that we can focus in on. And particularly dialoguing and discussing the negative things, particularly when we don't have any control over them, gets those negative thought processes going. And it cleans those negative circuits out pretty well, and that is really a setup for depression.
So, now, but let's talk practically, doctor. You're in your office, someone comes in, and you know that they are, you know, negative Nate or whatever. Not that someone whose name is Nate is that way at all,
yeah.
But here they're just very negative, and they're having just a real problem with it. What do you do to redirect them? And how can you help someone do that? It sounds almost like a spiritual problem.
Well, in a sense, it is a spiritual problem. And first of all, we have to have them recognize what's going on. And then secondly, they actually have to start exercises where they're avoiding the negative thinking. We actually, in people that are having particular problems with that, they have to go a 2-week period of time without saying anything negative about anyone or anything.
So how do you do that? You have like a, you know, with a heart patient, you have a cardiac monitor. What do? You have a microphone on them?
Well, it's a self-analysis type of thing. But once they go through, of course, everyone blows it the first couple of times. And once they blow it, they start their 2 weeks over again. So it doesn't have to start today necessarily. We want them to start today. But as soon as they say something negative, they start their 2-week period over again. And by the time 2 months are over with, most people actually have gone that 2 weeks of not saying anything negative about anyone or anything. Now, we're not against constructive criticism. But during that 2-week period of time, even constructive criticism is banned.
Out. Oh, so you really, you tighten it up.
We tighten it up because many people will try to rationalize their negative thinking and their negative stating in regards to saying, well, and trying to find something constructive later on that it might have helped with. And so we ban even constructive criticism for 2 weeks, and you would be amazing the mind shift that occurs in individuals after they have gone through this.
So you actually prescribe this as a medical doctor in your practice with folks, or is this something that you've read about those?
No, we've prescribed it with with patients. In fact, I will be honest with you. Many patients who have gotten off of their antidepressants have. I'll ask them afterwards. You know, in fact, I've had some patients who've been on antidepressants for years that never thought they were going to be able to live without them. And after we put them on the program that we outlined, and they get off their antidepressants and they're feeling good, I'll ask them, what thing do you think was the most important in this program? And a good share of them will point to what we're talking about just now, avoiding the negativism, avoiding the pessimistic thoughts as being the most important thing that changed their mindset around and opened the doors as far as allowing them to be free from depression.
Wow. So the last thing I see mentioned here in this this chapter, really from your new book, is daily spiritual exercises. And what do you mean by that exactly, and how is it related? What's the science behind that in our last couple minutes?
The frontal lobe is the seat of spirituality, morality, and the will. And the frontal lobe problems are at the seat of depression, as well as bipolar disorder and a number of other disorders. It stands to reason if we can enhance the circulation of the frontal lobe, we can actually prevent and even treat depression. And so, since this is where spirituality and morality is centered, it stands to reason by enhancing the spiritual focus and the moral focus and the abstract reasoning focus, we can enhance the circulation of the frontal lobe. And just because we need physical exercises every day, we also need spiritual exercises every day in order to enhance that frontal lobe area. And so this is why I recommend not just the mere reading of a text or the going through of the motions. Those type of things don't help. Doing the rosary, for instance, even though they might be spiritual exercises to some, that's not the type of spiritual exercise I'm talking about. I'm talking about actually contemplating on the great themes of Scripture or the great moral themes and spending some time analyzing them, looking at them. That really enhances frontal lobe function and can actually be a therapeutic measure in preventing as well as treating depression.
As a minister, I have to ask you one question. Will going to church help with depression or not?
Church attendance helps with depression as long as you're contemplating on the spiritual themes.
So listen to the sermon.
That's right.
We've been talking to Dr. Neil Nedley. We've been talking about depression and how to avoid it or prevent it or reverse it. Contact us for more information. Thanks for watching today.